I think that the question of how these things come to our attention, how do we measure it, was really one of the things that I wanted to talk about. How do we know that this is going on? Well, women seldom come out publicly and talk about this. It's a very private thing. Policemen, sometimes the police are called, and they very much don't want to interfere because they think this is quite a domestic issue. But we know through police reports, through hospital admissions, and through the number of calls to hotlines and the many, many organizations that exist that are set up to help women, to help them leave a violent situation or to help them deal with violence in their homes. There are many such organizations. In essentially almost every country in the world, we'll find a women's center that is working on this issue. And women's centers, women's organizations around the world will be working on this issue because, and I would say, I would consider it the central issue if we're concerned with women's health and women's rights, of course, women's rights or women's health. It is absolutely central to any discussion. And the reason for that is that, that I think that, is that violence against women is used as a strategy for people to maintain control. When they feel they've lost control, they use violence to maintain control. And now back to COVID, we find that people are especially thinking they've lost control of their lives. They've lost their jobs. They may be suffering ill health. They may be losing money for one reason or another. And there's a general sense of a loss of control. So we shouldn't be in the least surprised that violence against women is increasing tremendously during this COVID pandemic.